My colleagues and I were inspired to write this paper as we recognize the increasing complexity that primary care providers face in navigating the literature and the guidelines around breast cancer screening and risk stratification. My name is Adelaide McClintock, and I am an assistant professor at the University of Washington in Seattle and a primary care internist at the Women's Healthcare Center. I'm the lead author on the article Breast Cancer Risk Assessment, a Stepwise Approach for Primary Care Providers on the Front Lines of Shared Decision Making that will appear in this issue of the Mayo Clinic Proceedings. There's a lot of information to take in when making sense of the myriad of breast cancer screening guidelines, in addition to the already very full plate of primary care providers. Using a standardized framework, primary care providers can easily perform a breast cancer risk assessment in the primary care setting. These individualized risk assessments can be used to inform shared decision-making conversations about breast cancer screening. Physicians and patients alike are interested in individualized medicine. Providing an individual assessment of risk allows us to anchor these conversations as we make decisions together with our patients. Breast cancer risk assessment is one of the areas where researchers have derived several useful risk prediction models. However, primary care providers need to understand when and how to use them and how to contextualize the information that they give us. Our paper provides a framework for this process. It outlines a stepwise approach to the most commonly encountered breast cancer risk prediction models, how to use them, when to use them, and what their limitations and strengths are. The risk assessment generated by this approach can be used to inform screening strategies, with the goal of minimizing imaging for average risk women, while at the same time identifying higher than average risk women who may benefit from more frequent screening or screening with different imaging modalities or risk-reducing medications. We hope that a wider use of individualized risk assessment in the primary care setting will allow patients and their physicians to make more informed choices about breast cancer screening. Going forward, we still need to understand more about what the implications would be of a widespread implementation of risk-adjusted screening strategies for women in primary care. We don't yet know whether or not primary care providers will, with a little bit more training, feel equipped to do this, whether or not women find this information helpful, what the financial implications on our larger healthcare system might be if everyone adopts a risk-adjusted screening strategy, and whether this really will save women unnecessary imaging and biopsies.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.